Tooth implants in eyes, bringing sight to the blind. Blind people can see light thanks to tooth for eye technology. This process requires patients to go through many different stages and pain for nearly a year. Step 1. Tooth extraction. First, the doctor will select a large canine tooth in the patient's upper jaw and extract it. The tooth root is then thinned, and a small hole is drilled in the middle to embed an artificial cornea. Step 2. Tooth implantation in the cheek. Next, the doctor cuts a small hole in the patient's cheek and implants the tooth into it. After 3-6 months, new blood vessels and tissue will form around the tooth. Step 3. Epidermal graft. A piece of epidermis from inside the mouth will then be implanted onto the surface of the patient's eyeball, helping the eye to function and increasing the success rate for subsequent surgeries. Step 4. Remove the dead cuticle. After a while, the inner epidermis of the eyeball will be removed, the tooth will be removed from the cheek and fixed under the new epidermis. This process allows light to reach the retina, allowing the patient to see light again. Artificial corneal transplantation technology has been performed since 2005. A typical case is a person whose eyes were burned by aluminum liquid, thought to live in darkness for the rest of his life, miraculously recovered thanks to this technology. Tooth implant technology into the eye not only brings hope to the blind, but also emphasizes the importance of dental care. Maybe one day, a small tooth will save you from fire and water. If you know someone who can perform this surgery, please share the information so that more people have the opportunity to see the light again.